Why do I have cracks in my tongue? Hi, my name is Whitney and I'm a dental hygienist here to talk about your tongue and whether or not it's normal to see cracks on the tongue surface. So, is it normal? No, and yes. Sorry, I know that's an annoying answer, but the thing is, it's likely not a cause for concern. However, a typical tongue doesn't have big cracks in it. Of course, it is possible for someone to have a dry, sticky mouth or cracked lips if they are dehydrated, or if they have dry mouth in general, or if they've been out in the sun for hours, right? But if you are someone who has a chronic cracked tongue, especially one that lasts for more than a few days, it might be that you have something called a fissured tongue. And fissured tongues, where the tongue has big cracks or separations on top of it, it isn't rare. Fissured tongues aren't rare enough to say that they're totally abnormal. It's estimated that somewhere around 5% of people do have these cracks on their tongue. There's also something called geographic tongue, which can make your tongue look different as well, except the geographic tongue tends to be more patchy looking as opposed to the fissured cracks. And this one is even more rare, about 1 to 3% of the population has it. However, as a dental hygienist, since I've been practicing, I've probably seen more geographic tongues than fissured tongues, so you never know. Also, there are some instances where the two could possibly be related, but not always. So first, let's talk about fissured tongue, and then we'll get into geographic tongue. Fissured tongue. The fissures, the cracking, usually run right through the top surface of the tongue. You're unlikely to ever see cracking on the underside of the tongue. And even though a fissured tongue can look really weird when you stick out your tongue to look at it, most people won't even realize you have it unless you purposely show them. And you usually won't have any physical side effects with your fissured tongue. So if your tongue does feel raw or bleed, that's not normal, unless you literally just bit your tongue or burnt your tongue recently, right? So fissured tongue does not hurt. There is no pain associated with it. It just looks different. However, that being said, people who have a cracked tongue are more likely to have food get stuck in the cracks and problems with bad breath, since those deep crevices can easily harbor bacteria, and most bad breath bacteria are found on the tongue. I do have a tongue scraping video that I will link below. Anyone can benefit from tongue scraping, but if you are someone with a fissured tongue, it's even more the reason to brush your tongue and to use a tongue scraper daily. Now, what's the causes of a fissured tongue? Some people are born with it, while others develop it later on. Experts believe it typically forms as people get older, depending on their underlying medical factors, medical conditions. However, the oral medicine experts still do not know the primary cause. They just know that it's linked with certain medical conditions. For example, there have been many reports that a fissured tongue was one of the oral symptoms of people who had COVID-19. Lots of people after getting COVID experienced mouth ulcers and sores, redness, bad breath, and a bunch of stuff, including fissured tongue. Other conditions associated with fissured tongue are orofacial granulomatosis, which is often linked with conditions such as Crohn's disease. Down syndrome. Those with Down syndrome typically have larger than normal tongues and often breathe through their mouths, which results in being more prone to cracking or fissures on their tongue. Pustular psoriasis. There's a study where about 14% of those with pustular psoriasis showed evidence of a fissured tongue. Melkinson-Rosenthal syndrome. This is a fairly rare neurological condition, but it is associated with fissured tongue. And vitamin deficiencies such as iron. I've even heard it called anemic tongue before, as well as other vitamin deficiencies such as B2, B12, and zinc. And malnutrition in general, also overlapping with Crohn's disease. So how can you treat a fissured tongue? If you have it, what do you do? Unfortunately, there isn't an actual treatment to repair the cracks on your tongue, but just because there's technically no treatment for it, your doctor can still help you identify medical conditions that are linked to it, right? They can help you make the connection between your mouth and your body if it's related to a medical condition. With a bit of detective work, you may be able to do something as simple as adjust your diet or add supplements to help with the symptoms or severity of your tongue. But the big picture, overall, cracked tongues, fissured tongues aren't something that's alarming. They're nothing to stress out about because they aren't bad to have. Just be sure that your dentist and your dental hygienist are checking your fissured tongue during routine dental appointments to make sure there's no bacterial infections stuck in the crack. And remember that it's super important to brush your tongue and use a tongue scraper every day at home to help manage potential bacteria inside of the cracks on your tongue. And lastly, before we go, quick explanation about geographic tongue. Like I said earlier, experts do feel that fissured tongue may be somewhat linked to geographic tongue, and they do have a much better understanding of geographic tongue. For example, geographic tongue can sometimes feel sensitive or even like raw skin, which can make talking, chewing food, or swallowing uncomfortable. Because with geographic tongue, there are actual bald patches on the top of your tongue, and that's the reason geographic tongue gets its name, because of how the condition looks like continents on a map. nap. But the patches on your tongue don't just stay in one place. It's normal for them to morph and move around the tongue from one week to the next. That's why it's also known as migratory glossitis. Migratory is moving and glossitis is inflammation of the tongue. Geographic tongue also has an unknown direct cause, but it is known to be related to things like stress and anxiety, diabetes, hormones, allergies, and it also tends to be more prevalent in people who have clinical cases of psoriasis, similar to Fissured tongue. So in all, having cracks on the tongue or patchy tongue, none of that is a medical emergency. Just always make it a point to keep your tongue clean so that it doesn't trap bacteria or contribute to bad breath. Also, be sure to communicate your medical history with your dental team. Take your time filling out that health history form at the dentist. It's all related. It really helps your dental team to help you. And I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. I'll link all of my tongue videos in the description box if you'd like to learn more. And until next time, I'll see you on Instagram at Teeth Talk Girl. Peace, love, and tongues! And teeth.